in while we get started with an update from Captain Lankert. Captain Lankert?
Yeah, good afternoon, everybody. So if we can see the first slide. There we go. Okay, so this is going to be your update for California. Right now, there's a couple of different things that are changing. As briefed last time, there are about 18 counties that were eligible to move to expanded stage 2 of reopening, so that hasn't changed. Some other things that are going on are going to be that California had their single deadliest day this recent Tuesday, where we had about 132 deaths. So that's kind of in the bad news. The COVID's still here. It's still happening. You'll hear me say that every single week. On this brighter side of things, hospitalizations have dropped about 15% from their peak about 6 weeks ago, which kind of indicates that the curve is flattening. It's not necessarily going down. It's not necessarily doing much, but it's showing that at least the hospitals are not getting overburdened, which is what we want, which is what the whole curve flattening is. People are going to get sick. We just don't want them to get sick all at one time. So other than that, next slide. So this is missing this week's update, but basically that's the same curve that we've seen this whole time. You see a bunch of spikes there. The big spike, to reiterate, is going to be when those test kits were backlogged and now they were getting put into the system. We've seen consistent trends this whole time, kind of staying steady around about the 20 cases-ish in the local area per day, new cases. And that's going to be for Tehachapi, Lancaster, Palmdale, Roseman, and Cal City. And then on the right-hand side, that's just a reminder of this is the governor's four-staged, essentially, opening plan. So with stage 1, of course, being the make sure we're good now, and then slowly start unlocking it through a really phased approach. Importantly, the CDC has also released their guidance finally for states to use. It's about a 60-page document, actually, but it provides a lot of great outlines, such as looking at case counts, looking at percentage of positive tests coming back positive versus negative versus all that good stuff. So there's a lot of good direction for leaders around the country to be using. And then, of course, on Edwards Air Force Base, we're also looking into that and using that to also facilitate any advice we give to the wing commander and then what we're doing as a base response as well. Next slide. So since it's Memorial Day, we wanted to give a couple of good tips here because a lot of people I know are going to be wanting to go out, wanting to travel. What does this mean under the new COVID conditions? So I don't like calling it reopening necessarily or returning to normal. We're returning to an adjusted normal. So it's basically the new rules. So some things to keep in mind is that for public pools, splash pads, beaches, all those recreational areas that are now opening up, make sure you keep doing the same rules you've been doing the whole time, which is avoid coming in contact with a bunch of people. So keep that social distancing, whether it's your family, whether it's other beach goers. You can stay together as a family, but make sure that you stay away from other folks. We still want to keep that distance, wear masks as appropriate, bring your own materials such as towels and good stuff like that. Ensure as well you still practice that hygiene, because just because you go in the water or in the pool, it doesn't mean that cleans you of anything, essentially. And people that are swimming by each other can still infect each other because the virus comes from your respiratory tract. So someone swimming next to you is sick, is still off-gassing the virus, basically. So you still want to avoid people, but definitely there's safe ways to get out there, and those are all listed there. Make sure you continue to disinfect stuff. So if you're going to go sit down at tables, chairs, all that good type of stuff, pool noodles, says kickboards on there, make sure you disinfect it. Don't count on the water to disinfect it for you. Even if it's a chlorinated water, just do things the right way, and just wipe it down. Give it a good wipe down. Cloth face coverings, like I said before, and then also consider avoiding traveling long distances. We still want to stay around our local area. We still want to stay safe and basically by your home base. No pun intended there. And then also avoid sharing those items. So you're basically applying the same rules you've been living by to these new situations. So you don't want to share nose plug things. You don't want to share goggles, anything like that. Stuff, especially stuff that goes in your mouth, like snorkels. So just be mindful of those and try and follow those directions to really keep yourself safest as possible over Memorial Day weekend. Next slide. And this is just going to be for when you're traveling. So hotels, treat it like, it's your home away from home, but treat it like it is a foreign place because it's going to be. So make sure you wipe down those high-touched areas. Hotels in the region right now have definitely upped their sanitation practices, but you can only really rely on yourself to ensure that it's done properly. So make sure you wipe down the doorknobs, any other things. Don't set your toothbrush necessarily down on the counter and stuff like that. Try and really practice those really good hygiene things that we already do, just being more aware that COVID is a very real threat out there still. Gas stations, same thing. Avoid close contact with others. You're going to hear it repeated ad nauseum, essentially. Same rules. Wear a cloth face mask. Pack sufficient amounts of hand sanitizer, specifically for when you can't access that good soap and water, which is ideal for COVID. Restaurants and stores, as those things open up, same exact rules apply. You'll see places on base start to open up a bit as well. You want to practice that social distancing, practice that hand hygiene, wearing a mask as appropriate, and then just following the rules of the region that you're in, essentially. So just avoid that close contact, and most of the time you're going to end up eating outside now anyway, so that's usually the safest bet, because it's not all enclosed, and it basically dilutes any virus that would be there, more or less, and then avoiding people as well, just to foot stomp that. But those are basically ways for you to stay safe this Memorial Day weekend. Hopefully everybody has a good one. It's a long one, so I know I'm looking forward to it. But just please keep these rules in mind as we go forward into this kind of new world that we're going to have to operate in for the foreseeable future.
Thank you, Captain Lankert. And I just want to pile on with her Memorial Day weekend recommendations that we must continue to be mindful. We are under the local leave area policy, and that means also avoiding those dense places. So during this Memorial Day weekend, no, you want to be able to get out there, enjoy some of that, but you want to stay safe, keep your family safe, and then that helps keep the installation safe. So with that, we actually have a short clip to show you how we are doing our part to flatten that curve.
Household or yourself that has pre-existing medical conditions, just as asthma, COPD, diabetes, or any immunocompromised conditions? Okay, and there's a few more questions that I need to ask you. Any travel outside the local area within the past 14 days?
Hello, ma'am. We'll bring you to the clinic.
Copy that. Please have patient report to parking spot 1 and remind them to please remain in vehicle. He will be on the field. That patient will remain in vehicle.
Okay, ma'am. So parking spot 1, it's going to be at the stop sign. You're going to take a left. See the yellow cone? Uh-huh. Okay, so you're going to go right into the yellow cone. Make sure you remain in your vehicle. Keep your face mask on, and they'll come out to you.
Perfect. Alrighty. So first I'm just going to have you put this on your fingers. Up your 2 seconds. Heart rate is 82. Then next will just be your...
Good afternoon, ma'am. How are you today? Good, good, good. All right, so text came out. I already got your vitals and everything, so everything's looking good there, so that's the good news. Any changes in the symptoms from before when we talked to you on the phone? Okay, let's go ahead and have you step out of the car so I can do my physical exam, and then we'll get your appointment started.
Alright, ma'am. Now that we have the swab, we're going to go ahead and take it to lab. Once we get the results, the provider will call you and let you know what those are. Hi, this is Airman Keller over from the Dirty team. We just collected a COVID-19 swab. Could you just meet me at the cart so you can collect the swab and take it down to lab? Awesome, thanks. Bye.
Hi, my name is Edwards AFB with Public Health. May I speak to Sergeant Bailey? Hi, ma'am. Can I get your full name and date of birth? Alright, ma'am. The purpose of this call is I was trying to get some information from you. I was trying to get some contacts that you're with 48 hours before your symptoms developed.
Hey, thank you. Thank you.
back. So that is what we're doing to flatten that curve. So next slide. So here again is what you see weekly as far as our services. As you see, all our services are still available. And as things begin to change in the outside our gate, then we will start seeing more green areas as we bring more clinics, more services back online. And again, we continue to partner with our local community to make sure you have the care that you need at the right time and at the right place, whether that's here on base or off base, even during these COVID times. All right, next slide. And with that, now I'm going to turn it over to Captain Aqualia.
Awesome. Hi, guys. Well, thank you for having me back again this week. So we got a couple of new changes in pediatrics that I think you guys will be really excited for. If you can show the slides. So the first slide, just to recap from last week, this is what we've been doing. Thanks to all of the families at home that have been answering our calls, we've been able to get overcome a backlog of almost 200 patients younger than the age of 2 and get them caught up with their well visits. And then this is all the same. Next slide, please. So school forms, since the last time we spoke, there's a little bit of change. Since we've caught up more or less with our kiddos younger than 2, it's time to move on to our next priority. We are going to be starting school physicals, so well visits with the intent of filling out your paperwork so that way your kiddos can get enrolled into TK, kindergarten, or even our older kids that have just PCSed into the area and need to be enrolled in California. We're going to be starting that soon, and I'll talk about that process in a little bit. Next slide. Public service announcement from our immunization clinic, because I know a lot of people call in about what exactly are we offering. So our peds patients, the 2-4-12 that we mentioned last week, because we're starting our paperwork now for school enrollments, our vaccines that go in hand with that will be starting soon. And as always, our deployment needs, our imminent PCS needs, and now even our readiness needs that you're due for your next set of whatever vaccine, whatever labs, that's going to get started. And as always, anything that you, based on your particular medical history, need to get done because you're high risk for whatever, that can be done as well. But the biggest thing is that everything is by appointment only, even if it is just to fill out paperwork. So please call the appointment line, get that appointment scheduled for you guys. Next slide. Sorry. So no more slides for me, but like I said, that well visit for the school forms, what's going to happen is our kids that are turning 5 years old by December, because you have to be 5 by December to get started in this school year, are going to get contacted if you haven't had a well visit in the last year. We'll schedule you that appointment. It's going to be a face-to-face. It'll be a 30-minute slot, so that way there's nobody else in the waiting room, nothing, and we mitigate your risk for contracting any other illnesses by coming into the med group. Once we make that appointment, the day of your appointment, you'll get a phone call from us at the clinic to just re-screen you for COVID-related symptoms, cough, cold, things of that sort. And assuming you're in good health, you'll be given the all clear to actually come in and get your well visit done at your appointment time that was previously scheduled. If you do have a cough, cold, anything like that, no sweat, we'll talk about that, but then we'll reschedule you for a different day to get your needs taken care of as far as school. And like we said before, we've already talked to the school districts. They're more than willing and able to register you for the school year without this visit done, and they know that we'll get it done before the school year starts. So even if you can't make it because of whatever reason, illness or otherwise, that's okay. We have all summer, but we're going to be starting some point in June to get this get the ball rolling.
Thank you, Captain Aqualia. And to give us some resiliency tips is our shirt, Master Sergeant Flanagan. Master Sergeant Flanagan.
Good afternoon. As Colonel said, I'm the Med Group First Sergeant, Master Sergeant Brian Flanagan. So I just wanted to take this opportunity to sit down and say, through this time of even COVID and social distancing, teleworking, and everything else that's going on, First Sergeants are very much engaged and very much our business is operating as you would normally expect it to be operating. People are still in need. With things coming back online and the added stress and frustrations that are occurring with the unknown, some of the big tips that I can definitely encourage resilience. First is going to be education of the real facts. That way is the best way you can equip yourselves. Don't take unnecessary risks. If you're not able to get the information, your first sergeant is definitely more than equipped to reach out to. If you don't have a first sergeant or you're that population that can't pick up the phone and give one of us a call, find those medians that actually work for those support structures. The unknown is really scary. So I just encourage you guys to continue to connect. AFMC for the month of May has is connectedness for their resiliency main topic. My recommendation is if it's been a while since you picked up the phone and made a phone call or that FaceTime chat, it's probably time to have one of those phone calls and conversations. It's been stressed before, social distancing is not social isolation. For a first sergeant, we can't operate without people. That is what we do. So I encourage you to continue to take care of each other, operate with the known information that you have, make the best recommendations, and when you find those pockets of frustration, good coping mechanisms. Being that it's California, getting outside, having a run, having a jog, as long as you're not in isolation or quarantine, is something that I encourage everybody to do. Those pillars of resiliency, they're not just punchlines. They really are a lifestyle. So if you adopt those and make them part of your lifestyle, surviving COVID will be easy because you'll have every tool in your toolbox to be equipped with. So good luck, stay safe, and enjoy California.
Thank you, Master Sergeant Flanagan. Next slide. So again, we cannot do what we do in Flatten the Curve without your help. So please continue to cover your cough, physical distance, wear your mask, your cloth covering, and stay safe. Think of your family, think of the installation, think of Team Edwards. We are doing this together. And as always, if you are having any symptoms, any concerns, anything as far as thinking you may have been exposed to COVID, please call our appointment line so we can make sure you get the care that you need. And with that, we're going to turn it over to Chief Bradley as far as getting to your questions.
All right. Good afternoon, everybody. For those just joining us, I'd like to reintroduce everybody who's on our panel. So we have Colonel Gwendolyn Foster, our Med Group Commander, Captain Aaron Lankard, our Public Health Officer, Captain Meshfa Alqualia, our Pediatrician, and Master Sergeant Brian Flanagan, our Medical Group First Sergeant. So if you have any questions medically related or First Sergeant related that we can help you answer today, we'd love to do that for you here. You can either text those in to the number you see on your screen, or you can comment on our Med Group Facebook page where this video is live streaming right now. Okay, and so far we've only had one question that we got earlier in the week, and this one is for you, Captain Lankard, as Public Health. In light of the U.S. Attorney General's recent statement on religious practice and social distancing, will base public health consider altering their current recommendation to keep all base chapel services suspended until HPCon Alpha? Resumption of services with either appropriate social distancing, limited attendance, or outdoor seating would be beneficial to the spiritual and mental health of the base community. Captain Lankard?
Okay, so I definitely agree that's a good resource, and I know we've talked about it before for resiliency, for mental health, for all that good stuff. I know the spiritual community is a very important pillar of that. So that being said, most of the things you see on base that ended up either modifying their activities or shutting down were due to FPCon changes and us being in HPCon Charlie and all that good stuff. So you'll see going forward, a lot of things on base are going to start to, again, I don't like the reopening term, but they're going to start to adjust to the new normal. So that's why you'll see, like, Pandas is currently serving again. Some other places that at first were really locked down because we didn't know what was going on, or really how the local community was handling stuff, all that good stuff. So you will see some changes like that. Now, my office gives recommendations based on, hey, these are ways that you can mitigate things. These are ways that you could open up. But the ultimate say is going to be that chapel team, whether they feel comfortable with it. And then kind of what basically their leadership wants to do, essentially. So we always stand by to help advise on whether it's a chaplain, whether it's food service, whether it's a CDC, whether it's any of the myriad of places we have on base, we stand by to assist to help them to go to modified operations as best as possible. So I think some of the things you listed are good ideas, and we're seeing them in other places, such as the social distancing outside, all that good stuff. And again, public health stands by to assist any of the facilities on base with how they want to either resume operations, not resume operations, whatever they want to do. So we have not specifically been contacted by the chapel yet, but if we do, we're more than happy, like I said, to work with them and kind of help brainstorm ways for different things to start happening again under this new normal structure, essentially.
And I just want to pile on a little bit as far as General Higer is really public health and field. Make sure to advise them, because not only do we look at what's going on inside the gate, but what's going on outside the gate. So as we started looking at reopening, it's a hard word to find what else to as we adjust to the new normal, we want to make sure, one, that we are seeing a downward trend of cases, which we are not seeing right now. We want to make sure that the medical facilities can accommodate if we start having a lot of COVID patients, which we know we can do right now at this time. And then we want to see also the number of cases as far as individuals having symptoms. So those are the three criteria that we are monitoring closely as we start looking at things that we can really bring back online. Because at the end of the day, we want to make sure we keep you safe. Thank you, Captain Lankert.
All right, we have a question that just came in. When will we know after June 30th when face-to-face overseas clearance physicals will be available? So, and I'm not sure if they're talking for family members or for active duty members, but face-to-face overseas clearance physicals.
All right, so as far as clearances, anything for in-processing, out-processing, we are starting to bring those services back, seeing what we can do virtually and what we need to do face-to-face. So anything that has to do with the overseas clearance, please call our appointment line, 277-7118, and we will get you the resources you need to begin to do that. So we are already starting to bring those things back online.
Thank you, ma'am. Yeah, just to caveat on that, June 30th is what we were directed by our Air Force SG office to hold for now, but we understand that people do have cases where we may need to address it sooner. So bottom line, be that patient who speaks up and lets us know your needs so that we can make sure we're giving you what you need. We don't want to get anybody to get lost in the process. Okay, we had another question come in for Captain Lankert. How closely does the Med Group public health recommendations follow the California or Kern County recommendations for opening back up?
Yeah, so just like how we mentioned in the past thing, there's a lot of stuff that goes into opening up. So what we're doing is we're basically taking the information from both California, from Kern, from the CDC, from the state, looking at what other states are doing, and then combining that with the DOD's overarching recommendations. So we're actually completely in line, if not more so than a lot of other places. So all of our recommendations are going to be based on risk. So it's going to be like, this is what the local area is doing. This is what this means. This is what could happen. And this is what we're looking at going forward. So based on that, we're really, really pushing the whole modified new normal thing. So that's why I'm going to sound like a broken record, but that's why you'll see places starting to reopen a little bit, but under certain rules. So we are definitely not proponents of let's lock everything down, let's keep it locked down until COVID goes away, because that's not practical. We're seeing everywhere around the country right now, people are resistant to that too, which makes sense because you get tired of just being told you can't do this, you can't do this. So that being said, we recognize COVID's here. It's still a very real threat to the base. It's still a very real threat to the Air Force and the country and basically everybody around the world at the moment. That being said, there are ways and rules you can play by that we can start opening up and going back to some regular activities, such as the food facilities, such as different activities like that you could be doing outside, stuff like that. Even the hospital is we are looking at evaluating what can we do now as far as like the visits and all that good stuff. So we are absolutely in lockstep with what California, Kern, CDC, Air Force, everybody is saying, and we're advising the base commander as such to to those things. So it's going to be a slow process. We might not always mirror the outside because we sometimes are going to be looking at a different type of picture, because I know Governor Newsom has his own things he's looking at. Kern County has their different recommendations, so no place is identical. But please rest assured that we are looking at basically every single data source we can, and then how the disease is modifying itself, what's happening, what are the trends, and that's how we're advising the base commander in order to keep this as safe as it is right now, and kind of get us through the situation to whenever the situation changes, essentially.
Thank you, Captain Lankard. Okay, we have a question. When a vaccine has been found, is there any guidance on how it will be dispersed around the base? Captain Lankard.
Yes, ma'am. So right now we haven't really had many talks about how the vaccine is being dispersed around the base. I think the bigger concern that a lot of people in the public health career field, I'm not saying just Air Force public health, is how, once a vaccine is made, how's that going to get out, period, to the United States? Because right now there are some talks about, hey, hey, once we get a mass-produced vaccine, how do you give it out efficaciously? So that means like fairly, essentially, to those who need it, to those who are at risk, because obviously everybody is going to be potentially at risk. But there's a lot of high-level discussions that happen outside the Air Force and at the big federal level about, hey, how do we do this? How do we do it right? And how do we do it so that it protects the most amount of people? So on Edwards specifically, it'll all depend on how that process goes as far as then what are we going to do. Right now, I know there are a bunch of vaccines that are in development. I know a lot of the manufacturers have actually come together to do giant studies on it, which is pretty cool for the first time, I think pretty much ever, that they're all coming together to be like, all right, let's all work on this and all find it out so we don't have to do millions of little studies. But once we get more advice, once we get further along that process, once the federal government gets an idea of how much they're going to have, then we'll also take guidance from big Air Force, and usually it's going to be like MAGCOM or higher that's going to give us kind of a guidance as far as what does the Air Force want to do as far as who we want to vaccinate, who we want to prioritize, and then there will most likely be some additional wiggle room that Edwards ourselves can kind of have based on each individual base and what our needs are. So short story, there's not a lot of specific guidance right now. Long story is we predict it once the vaccine does start rolling out, but we have to look out for that giant federal response first to kind of see what the playing field's like.
Thank you, ma'am. And just to add on to that, it will likely look a lot like what influenza vaccine looks like right now. So there is a hierarchy that we immunize people. You know, we get out our first responders first, our medical workers, because we don't want to be getting you sick when you come in to see us to get healthy. So it's very similar to influenza, I would expect. All right, we have a question. When will the barbershop open? That's not one that we can answer here. We are there to advise, but along with all those different units on base, they are looking at how we can really get back to full capacity. So I know they are looking at that. We just can't tell you when it'll be. All right, we have another question. Is it possible for active duty members to get G6PD lab test for IMR and PPD immunization? I'm not sure. Do we have the right SMEs to address that one today?
Yeah, so as far as getting labs, and it has to do with your IMR, please call the appointment line again, 277-7118, and they will help you establish when you can come into the lab to be able to get those lab tests performed. Because that is readiness, and we still have a wartime mission to get after, we are bringing those services online. So again, call the appointment line, and we will let you know when you can come in to get those lab tests done.
Thank you. And just so lab services are available mostly on a walk-in basis, but for that particular service, just call and ask first. But most of your typical lab services, they are still offering as walk-in, and that is one of the very few walk-ins that we do have. All right, we have another one. Any recommendations for dealing with family and friends outside the military who are starting to hear it's safe to come over for a barbecue?
Captain Lankard.
That is an excellent question. So a lot of the things we're dealing with right now are going to be families and friends, even yourselves, that are hearing a lot of what we like to call basically it's noise about other things saying this is fine now, this is not fine now. We always want to say follow the CDC recommendations, follow what your local public health is saying, follow the California Department of Public Health, but I would not recommend having people, especially from outside the local area, come to your house for a barbecue, especially if it's a solid amount of people. Because again, that breaks those first two rules of basically of COVID, which is minimize the amount of people you're around and social distance. You're much less likely to social distance around your family members that are coming from out of state, just because we all miss each other, or not out of state, but out of the local area, because everybody misses each other right now, just like how the shirt said. You get really separated, and it's not a fun time in that sense, but at the same time, you want to keep yourself safe. So just because people are hearing, oh, it's fine to have a barbecue and such, right now there's no data to support that the situation has changed at all from even like a couple of weeks ago. So keep just hammering that social distancing, minimize the gatherings. You could have your family come over or meet you at a park or something and do a really widespread thing, but definitely try to minimize those gatherings as much as physically possible, especially outside the local area as well, because the last thing we'd want is someone coming from a different state, a different hot zone that obviously we're not going to be tracking, and then they expose you to something when they didn't even know that they were sick. And it would also help them prevent them from traveling as well, when they don't necessarily have to. So I know Memorial Day is going to be a little rough this year potentially because we don't have those cool barbecues and all the other good stuff that we're used to. But you want to just ultimately keep yourself and your family safe, because again, the last thing we'd want is someone to get sick from a family member or whatnot. That would feel pretty awful. So yeah, just keep doing that social distancing and avoid those situations as much as possible.
Thank you, ma'am.
Yeah, and just I wanted to add, as you're thinking about whether or not you should social gather or not, ask the first question: is it essential? Is this something that has to be done? And if the answer is no, it can wait, because again, we want to keep you safe.
Very good advice. We just got a question. There are some county and Los Angeles testing sites opening. Should I go get tested?
So that's a great question. It depends on who you are. So it depends if you're a contractor and your leadership and your company says to do X, Y, or Z. That's one thing. Most of the people we're going to want to have get tested on base, or it's going to be like active duty members, some civilians. We prefer that if you qualify for testing in our house, that we get it tested here, because that means my unit has positive control over it. We can talk to lab directly. We know the situation, your PCM's here, all that good stuff. If you get tested off base, what ends up happening, especially if you don't necessarily need to, you could have a false result. You could not have the appropriate follow-up you need, or the doctor might be playing follow-up once they do get your results. And also, we don't have good ways of basically tracking folks that do that, and that doesn't really help anybody, because it'll be a lot harder to keep track of, hey, what's your result? What does your PCM think? All that good stuff if you just go off base and get tested. So if you need to get tested or feel like you should get tested, please contact your PCM at the med group, especially if you can qualify on base. Again, if you're in a different category where you don't qualify for care on base or anything of that nature, follow whatever your current healthcare provider says, and kind of go with that is what we would recommend. But we definitely, especially as we get increased testing capacity, prefer that people talk to the PCM on base and get tested here rather than just going off into the local community and doing it.
And we'll basically hang back on our Facebook page our lab testing guide, because right now, for you to be able to get that off-base testing, you have to have a process into the system. So we are not aware of any of the lab testing sites allowing just walk-ins without an appointment. We will confirm that with HealthNet to make sure nothing has changed, but we want to make sure if you're getting tested, you are getting tested appropriately and getting into the system appropriately.
Speaking of testing, how close are we to having in-house COVID testing available?
Well, we actually have the BioFire. That is the type of equipment to be able to do in-house testing. Right now, we are waiting on the supply chain, though. So we anticipate that we will be able to start using that BioFire to do in-house testing within the next 1 to 2 weeks. So we do have the equipment. Now we are in the process of getting that supply chain solidified and validating that equipment to make sure that it can run the test appropriately. And once that is completed, we will start actually running tests in-house. So again, thinking about 1 to 2 weeks, but we will continue to keep you updated on that.
Thank you. We got a question in: how accurate are the antibody tests, and does that mean you're immune? And there's no quick answer to that right now. They're finding that a lot of the tests that they did early on weren't maybe that valid. So we've been very cautious on rolling out any kind of antibody tests just to make sure that they truly are giving us the validity that we require. And as far as immunity, they're still looking into that as well. Captain Linkard, I don't know if you have any more to add to that.
Yeah, right now the most recent updates, at least from the World Health Organization and the CDC that's kind of in lock with them, is that's the big point, is just even if they're valid, so they show you antibodies, apparently they don't always show if you have antibodies, and then even if you do have antibodies, doesn't necessarily mean that you can't be reinfected. So there have been some cases where people have gotten COVID multiple times. Like they allegedly resolved, and then, oh, hey, I have another infection. So there's a lot more data that has to be gathered on that. So right now, using that as a reliable source of saying, hey, you're immune, would not be really a wise decision, because we don't know that for sure. And especially the ramifications of now thinking, oh, hey, I'm immune from COVID, I might not have to do X, Y, or Z, or I might be more protected. We definitely don't want to promote the idea of you being protected if you're not. So yeah, just like how Chief said, it's pretty sketchy at best, and they need to have a lot more information coming in, especially as the outbreak or pandemic progresses. We'll expect to see more information on if that actually conveys immunity or not.
Thank you, ma'am. A question on if we'll have antibody testing available on base. And although we'll be able to collect those samples in-house, we will have to send them off to one of our 2 reference labs for analysis. We won't be able to do the analysis in-house, but we will be able to collect the sample as long as it's deemed medically necessary by that provider. A question here, I'm not sure we can answer it, but if the sailors, it's regarding sailors in Guam, if they did really get reinfected, I think we'll have to defer that one. I'm not sure on that.
I think I can talk to that one.
You can?
A little bit, yeah. If that's the same thing I was thinking about with on the aircraft carrier, where they were infected, cleared, then reinfected, that's kind of what I was alluding to. Don't know. From the last that I've read, we don't know if it was a true, hey, they absolutely cleared the infection and got reinfected, or if it was they were still sick even though they cleared the 14 days. So they're still trying to look into that, the last that I was able to see. But that does bring up 2 possibilities, because we have had people that keep testing positive for COVID for extended amounts of time in certain situations. So it could have been one of those, or it could have been the whole, hey, we got absolutely cleared, which is what it originally looked like, and then got flat out a new infection. But basically, the moral of the story is we don't know for sure, but it's a possibility. We can't rule it out.
Thank you. A question for our pediatrician, Dr. Akwalia. What recommendations do you have for people who have young children in the house as far as keeping them safe?
So for young children, no matter what your age range you're talking about, if you're talking the 2 and younger, the newborn, the 5-year-old, some people think that their 12-year-old is still young, and they are in the relative grand scheme of things. So just doing everything else that the public health systems of base, California, Kern County, LA County is asking us to do is wash your hands frequently, especially prior to eating, after you use the bathroom, after you've been outside at the playground or playing with whatever toys that you have been. Wash your hands, wash your hands, wash your hands. That's the best way that we have for protecting ourselves, not only from novel coronavirus, but from infection of all causes. Keep up with your medical appointments. I know right now we're the limiting factor as the med group. Even if you want to come in, we're saying, hey, hold on, maybe this isn't as much as a priority. But if we're offering something, whether it be that 2-year and younger visit or now our school physical visit, know that we have your best interest at heart. We're doing the things that we can to keep you safe, wearing our masks, wearing our gloves, of spreading out our appointment times, only seeing a certain number of patients per day, having the clean team and the acute care team, so that way we can still get your maintenance things done.
Thank you, ma'am. All right, Shirt Flanagan, question for you. What are some of the common resources you find yourself directing our airmen to?
So that really is kind of a loaded question, but the reality is I find myself directing them to financial resources mostly, especially in this kind of time. You would think that spending and that kind of stuff has kind of slowed down, but that power of that online, that click and buy and pay later, those credit card bills are coming in. So biggest thing I can definitely encourage folks is stay on top of your own personal finances. If you find yourself in need and you have the ability to contact the Ameren Family Readiness Center, they're a great tool, resources. There really is, if you run into roadblocks, that's what a First Sergeant is there for. So that's really one of the primary resources. That, and then, of course, counseling services. Stress is stress. Added stress now, added frustration, and like I said before, that unknown. So when our mental health folks put things out, the Military One Source, our MFLEX, the programs are up and running, and they are taking calls. So please utilize those resources. If you need those resources, numbers, and information, and you have availability to them, contact your unit First Sergeant. If they can't get a hold of you, we'll definitely work through the Ameren Family Readiness Center and make sure you guys are equipped with those numbers. So those are the two primary ones that we actually get used a lot.
Thank you, Shirt. And speaking of mental health services, I'd like to say that May is the month for mental health. And Captain Gordon from our mental health office has recently started a podcast called Mood Food. So you can look on Apple and any kind of Android and try to download that podcast. And maybe when you go out on that run, listen to some Mood Food. Okay, we are still waiting for some more questions to come in, but I know we're getting close to wrapping up. We just got one on allergy shots. What's an estimated time frame when allergy shots can be continued?
We will actually get back to you on that question. We want to make sure that we give out the most up-to-date and accurate information. I know that is something that we are monitoring closely, so we will get that out on our Facebook page and then also make sure to update you at the next weekly town hall.
Thank you, ma'am. Okay, and again, since we're waiting, just a note as well, since tomorrow, Friday, is a family day, General Hygert is not having a town hall tomorrow, just for your own information. If you usually tune into this town hall and then tune into that one. So those will resume again next week. Does anybody have anything they'd like to readdress with our viewing crowd today? Okay, on that note, last chance to get that question in. And okay, we'll go ahead and wrap it up.
All right, first, as always, I just want to thank you for tuning in. And as we're going into this Memorial Day weekend, as you heard us say all the things to make sure to keep you safe and your loved ones safe, we do want you to enjoy this long weekend, but we want to make sure that everyone comes back well at the beginning of next week. And as we know with Memorial Day, that is really the time to take to reflect on those who actually gave that ultimate sacrifice. So please enjoy your Memorial Day weekend. We are proud to serve and to be your medical group, and we will see you next week.